Coughs and colds are a common part of childhood, especially during the colder months or when children first begin attending nursery or school. Most of the time, these are mild, short-lived illnesses caused by viruses, and they tend to resolve with rest, fluids, and a bit of time. But when these infections become frequent, take longer to settle, or seem more severe than expected, it's natural for parents to worry, and often difficult to know when to seek further help. So understanding what's normal. Young children, particularly those in group childcare settings, can have up to 8 to 12 viral respiratory infections per year. These are usually mild, self-limiting, and get better within 1 to 2 weeks without the need for treatment or antibiotics. However, if your child requires frequent antibiotics for chest infections, they have ongoing cough, wheeze, or breathlessness between illnesses, or they've needed hospitalization more than once with a severe respiratory illness, then it's important to consider whether there could be an underlying cause contributing towards their pattern of illness. So why do some children get breathing illnesses more often? Well, in many cases, a young child's immune system is simply still developing, and susceptibility to viruses is just part of the natural growing up process. Most children will outgrow this phase. But sometimes other factors may play a part, and these include things like environmental irritants like tobacco smoke, mold, or air pollution, being the youngest child with older siblings who bring home viruses from school. Allergies, including rhinitis with postnasal drip, can present with ongoing cough, and even having acid reflux can irritate the airways, causing recurrent respiratory symptoms. In most cases, an underlying respiratory condition should be ruled out, such as asthma, which may also present with recurrent breathing difficulties, immune deficiencies, structural lung problems, chronic aspiration due to swallowing difficulties, or more rarely still, an underlying chronic lung disease like cystic fibrosis. So, what can be done if you're worried? The first step is usually a thorough review by your child's GP in primary care, focusing on how the child is growing, whether they recover fully between illnesses, and how often antibiotics are being used. If your child is thriving, has clear symptom-free periods, and infections are clearly linked to viral exposures, then this is generally reassuring. But if your child isn't gaining weight, continues to cough or wheeze between infections, or seems increasingly unwell with each episode, then further investigation is often appropriate. When should you refer to a paediatric respiratory specialist? Well, this should be considered when infections are severe, persistent, or frequent, if there's uncertainty about the diagnosis, if your child's symptoms are impacting their development, school, or sleep, if there's concerns about a possible underlying lung disease. So after a detailed history and examination, further specialist assessments can include things like lung function testing, chest imaging like chest x-rays or CT scans, or blood tests for immune function and possible allergic triggers. And sometimes more detailed evaluations including bronchoscopy, depending on the other findings. What can you do to support your child whilst waiting for investigations? Well, there are several simple but really effective ways to support your child's respiratory health. Firstly, avoiding tobacco smoke and other respiratory irritants, ensuring their routine and booster vaccinations up to date, promoting a healthy lifestyle including nutrition, regular exercise and good hand hygiene, and ensuring that they are using any prescribed medications regularly and appropriately, including good inhaler technique if they are prescribed an inhaler. Final thoughts. So, recurrent respiratory infections are often part of a child's early years. This is normal. But persistent, severe, or unusual patterns should not be ignored. Early assessment and the right support can make a significant difference to a child's health, well-being, and future lung function. If your child is experiencing repeated chest infections, ongoing cough or wheeze, or breathing difficulties that aren't improving as expected, then it may be time to discuss with your GP about the need for a specialist referral, either through the NHS or directly with me here at the Health Suite. As a children's respiratory specialist, my aim is to work with families to identify the underlying cause for their child's respiratory symptoms and provide a clear, evidence-based plan for moving forwards.